My name is Ryan and I'm going to be doing the med administration. Olivia's recording and Elizabeth is doing my assessment. So I'm going to start with hand hygiene and I'm going to take a look at my MAR. So I have patient Jamie Wheeler and I've got provider orders to administer 250 mcgs orally of digoxin, 1,000 mcgs IM of vitamin B12, and 10 units subcutaneously of insulin detamir or Levemir. So I'm going to go over to my med room and I'm going to start with my insulin because that has to be administered in the med room. So this is not expired and it is 100 units per ml and I need 10 units. So I am going to grab my insulin and I've got some alcohol pads and I'm going to go ahead and administer that here. Get some clothes. Alright. I'm going to wipe this off and let it air dry. I'm going to go ahead and get my 10 units. And normally I would have another nurse come in and check the 5 rights of insulin. So the right medication, the right dose, the 10 units, the right patient before I administer, right route, and right time. So I'm going to go ahead and throw this stuff away before I get my other meds. And I'm also going to label this as 10 units for the other nurse to check. So I have my name of medication, 10 units, the patient initial and my initial, and 8 o'clock. Alright, and now I'm going to go ahead and get my other medications. So I've got my 250 mcgs of digoxin. Each one is 0.25 milligrams, so I'm just going to use one tablet. And this is not expired. And that's going to be oral. So I'm going to grab a cup for some water for my patient as well. And then for vitamin B12, it is 1,000 mcgs per milliliter, and I need 1,000 mcgs. So I'm going to grab my 3 milliliter syringe, and it is IN, so I'm going to use a 1.5 inch needle. I'm going to grab this. I'm going to change out my gloves. So, I'm going to introduce myself to my patient. Hi, I'm going to be your nurse today. My name is Ryan, and I'm going to be administering some medication. Can you start by telling me your name and date of birth? So, I'm verifying that this is Jamie Wheeler. Date of birth is 10/31/1947. And do you have any allergies that I should know of today? Patient is allergic to codeine, and I can verify that with the MAR. patient allergy. So today I'm going to be administering digoxin, which is an oral medication. It is to help with increased cardiac output and to slow your heart rate. Some side effects that you may encounter would include some fatigue, arrhythmia, nausea, and vomiting. So after I administer this medication, just let me know if you have any experience of those side effects. Before administering, I would check the patient's apical pulse, heart rate, monitor blood pressure, and assess IV sites, and then intake and output. And then I'm also going to be administering B12 into your shoulder. Some assessments that I would do for that would just be to look for any signs of vitamin B12 deficiencies. Some side effects that might come with B12 would include hypersensitivity, headache, diarrhea. And then for the insulin, this is to control hyperglycemia in diabetic patients. And so I would assess signs and symptoms of hypoglycemia or hyperglycemia and monitor a patient's body weight. Some side effects that might come from insulin would include hypoglycemia, hypokalemia, arrhythmia, or swelling. So I'm going to start actually with the digoxin. And patient is able to take a pill, so it's going to be taken with liquids. So this is the 250 mcgs of digoxin, and then my vitamin B12, write this down and let it air dry. And I'm going to take my 3 milliliter syringe for any air bubbles. Right. And I'm going to go ahead and change out this needle to avoid any dulling or pain to the patient. And I'm going to label my syringe. This was his shapes. Okay, so I've got my meds. Now I'm going to start with the digoxin. Mr. Wheeler, would you like to take this by yourself, or do you want me to put it in your mouth? All right. So I'm giving the pill, and here's some water to get that down. I verified that patient swallowed pill. So patient took the 250 mcgs of digoxin. I am now going to administer my insulin, and it is subcutaneous, so it is going to be administered into the abdomen. And this again is to help with hypoglycemia. And I'm going to ensure patient privacy. And I am cleaning the injection site in a circular motion, in to out. So I'm going to come and start by pinching the skin, and I'm going to insert at a 90-degree angle. Slowly inject and hold for 10 seconds. And then administer into the. And now I'm going to go ahead and administer the vitamin B12, and this is going to be in the deltoid because it's IM. So I'm going to come over, and to find my site of injection, I'm going to put 2 fingers on the greater trochanter of the shoulder, and then come down right below the armpit, and this is going to be my site of injection. And I'm going to pull it skin taut for the Z-track method. I'm going to start by cleaning the wound site from in to out. Again, I'm going to pull the skin taut and go in at a 90-degree angle. I'm going to administer slowly and hold for 10 seconds. And then I'm going to initiate the safety and put this into my here. All right, Mr. Wheeler. Again, I can read you those side effects with the B12 that I just gave you. Again, you might experience some hypersensitivity, headache, diarrhea. With the insulin, we're just going to watch for signs of arrhythmia, swelling, hypoglycemia, or hypokalemia. And then with the digoxin, we're just going to be looking for any signs of fatigue, arrhythmia, nausea, vomiting. So let me know if you experience any of those symptoms. I would then come over to my MAR and document. So the digoxin I gave on 3/23 at 8 a.m. I gave it orally with water. And then for B12, 3/23, I gave it into the deltoid at 8 o'clock. And then for the insulin, I had another nurse come and check my 5 rights, and I administered 10 units into lower right abdomen at 8 o'clock. I would then doff my gloves and perform hand hygiene. And sign off that I administered the provided